parts of the world. So it's early in the morning in Los Angeles and the West Coast. It's 7:30ish, but I'm sure it's different time zones and different. So welcome to our May Career Development webinar. And today we're very honored to have Dr. Emmanuel Balandya. I don't know if I'm pronouncing your name right.
Absolutely.
Okay, great. So before we begin, let me just make a quick introduction for Dr. Emmanuel Balandya. And then I think what we can do is, as before, have Emmanuel share your work for about, let's see, like 40 minutes. So this is an hour slot, right? Richard? Okay, so, and then the remaining 15 or 20 minutes or so, we can have an opportunity to ask, make an informal setting and then ask him questions and get his guidance. All right, so I have a little blurb. So Dr. Emmanuel Balandya is a physician scientist with expertise in biomedical sciences, and it's encompassing physiology, hematology, immunology, and vaccinology. And he obtained his medical degree in the University of Dar es Salaam, Tanzania, and doctorate degree in Dartmouth College and postdoctoral fellowship at Harvard Medical School. So I'm sure he has a lot to say about his experience. And after returning to Tanzania in 2014, he has researched on immunity and infections in sickle cell disease. And this was funded through NIH Fogarty GloCal Fellowship, and is currently the PI of Sickle Pan-African Research Consortium in Tanzania. It's a U01 grant funded by NHLBI. He's also a co-investigator on several ongoing health research and education capacity building projects, and he has published and presented his work at many national and international platforms. And he's also the director of postgraduate studies at MUHAS, board member of Young Scientist Tanzania, a nationwide science outreach program. And he also does consulting with the National Institute of Medical Research at Tanzania Commission for Universities on matters related to health research and education. So this is just a small synthesis of his accomplishments, but in the interest of time, I will turn it over to Dr. Emmanuel Balandya, and let's have a productive session today. Welcome.
Thanks very much, Dr. Lee. It's great to meet you, although visually. I hope maybe one day we can have a physical meeting. Richard, thanks for organizing and for all the work you did. We did together remotely to prepare for this. So am I to share my slides, or Richard, are you going to do? Should I go ahead and share? Okay. Okay, can you see the full screen of my slides now?
Yes, we can.
Okay, great. So I was just thinking of how do I structure this presentation. I thought of, structuring it as, transitioning from early to established research careers. So as Dr. Lee already introduced me, I'm a former GloCal Fellow. So that was way back in 2015. And currently I'm PI of the Sickle Pan-African Research Consortium, SPARCO, for Tanzania. Okay, so I'll cover those 4 areas: my professional training, and then the history of my fellowships, and then the grants, the past and present, and then lessons learned or advice by way of punchlines in terms of, and I hope you'll be able to use some of those advice going forward for your own careers as well. So I'm coming from Muhimbili University, and I was going through the profiles of fellow this year, and I'm glad Dr. Steria, who is a colleague here at MUHAS, is also a fellow. So I did my MD between 2000 and 2005. Then the Mumbiri University of Health and Allied Sciences was a university college of another university called University of Dar es Salaam. So, but now it's, since 2007, it grew to be a fully fledged university on its own. And I am working at the same university now as faculty. So for Tanzania, the way the medical education is structured is that you do 5 years of training, and then you do 1 year of internship. So 1 year of internship is equivalent to the first year of residency in the US. So you can look at it that way. So for me, this 1 year of internship plus the 5 years of medical training gave me the foundation of both medicine, but also sciences. Because the way your medical degree is structured, at the first 3 years, we were really grounded in the sciences. So you do physiology, you do biochemistry, immunology, vaccinology, and all these things. So I was really, at the end of these 6 years total, I was, you could say, I had the good basics for both the sciences and medicine. And then I transitioned 2008 to the US at Dartmouth Medical. And here, this is where I did my doctorate degree for 4 years until 2012. So this really now, introduced me to the sciences. And apart from the training and the PhD, these 4 years were critical for me because I was able to travel internationally during this period to showcase my work. And I traveled and participated in big conferences in the US itself, in Europe, Africa, several conferences, including CROI and others. So this was the big opportunity for me to network, to know the global leaders in the field, and know how science was conducted at the highest level. And then 2012, 2014, so this was immediately after finishing my doctorate. I applied and I was lucky to be accepted for a 2-year postdoc at Harvard Medical in the lab of Dr. Dan Baruch. Some of you may know him. He's a global leader in vaccinology and developing novel vaccine vectors. And I was participating in one study that was developing those for novel HIV vaccines. So this was, again, an opportunity. So for the way I thought about postdoc was to complement my PhD, and I carefully chose a lab that would build on the skills that I already acquired by increasing the breadth. So for instance, where I did my PhD, it was more physiology, immunology. I had no vaccinology, but here there was a lot of vaccinology. But then this was a top-notch lab globally, and it was great those 2 years to interact with global leaders within Harvard and from outside Harvard in the field. So in terms of fellowships, the first one is a fellowship that supported my PhD, 2008-2012. This was a mechanism in NIH Fogarty. It was called ITRI, for AIDS International Training and Research Program. I'm not sure if it's still there. Probably it's been replaced by other mechanisms, the D43s and others. But it was very, very useful. So for MUHAS, 3 PhDs benefited from this. I was one of those. And then the Global Health Fellowship through University of California Global Health Institute. This was for me between 2015 and 2016. And it really provided me some sort of bridging funds to return home. So I had already I was at home when I applied for this, and it really helped me in that transition. So these were my mentors. At the bottom, that is Professor Julie Makani. So he's a renowned hematologist working here at MUHAS, and he was my local site mentor. And then the gentleman at the middle, Professor Stephen Obaro, is a pediatrician and immunologist working at Nebraska, University of Nebraska Medical Center. And then from UCSF, Taylor Reynolds. So the work that we did, for me, maybe this speaks to flexibility also. So I was able to quickly look into the current environment, what was topical, what was the major disease of interest, and sickle cell was one, and Julie had done a lot already in profiling sickle cell. And then I'm coming in with my immunology know-how and combining the two. And when I did literature review, it was quickly apparent that even at the global stage, there was a lot of interest, but there was a lot of gaps to be filled in terms of immune knowledge in sickle cell disease. So we did work that was published, and this gave us some good profiles. So I remember my work was profiled in Fogarty website. So I was looking back as I was preparing for this, and this post is still there. Basically reporting what I was doing back then in 2015. So funding history, the past. We report this one as a major funding of mention, and we applied for this grant together with Julie, who was my site mentor for GloCal, immediately around the time when I finished my GloCal Fellowship. And Julie was able to put together a team of colleagues from not only Tanzania, but from Ghana and Nigeria to form what we call the Sickle Pan-African Research Consortium. And the aim was to promote, strengthen, and develop research as a strategy to improve health advocacy and training in sickle cell in Africa. So we submitted around 2016, 2017, it was funded until basically end of, it just expired in April, this grant. So we had this for 4 years. Julie was the PI for the consortium, and I was co-investigator and PI for Tanzania in this grant. So here, again, it gave me another opportunity. As you can see, the growth from a small global health fellowship in GloCal, and then now increasing a little bit to managing a national grant as part of a bigger grant. And then by the time this was going to expire last year, 2020, NIH approached us and said they were interested in our progress, and they were going to announce opportunity for extension of this, but they wanted to change the grant in a way that instead of being one grant with countries like Ghana and Nigeria sub-awarded, they wanted each country to be its own site. And they wanted to have a clinical coordinating center as well as a data coordinating center. So for MUHAS now, we had the opportunity to apply on our own for Tanzania, and I had an opportunity to apply as a PI. And good news, last week, actually, we received news of funding. This is the U01 mechanism by National Heart, Lung, Blood Institute. So for Tanzania, again, we are funded for 2020 until 2026, now a 5-year funding period as part of a larger network in Sub-Saharan Africa. And they will fund 6 sites or 6 countries in Africa. So we're still waiting for the other country that received the notice of award. So in other words, this is my major NIH or major funding where I am as a direct PI. So SPARCO The ones in red are countries where SPARCO 1 was operational in Ghana, Nigeria, and Tanzania. And there was a sister grant awarded also by National Heart Lung Blood Institute to UCT, University of Cape Town in South Africa, to provide data coordination. So one of the aims in SPARCO was to form an electronic database of sickle cell patients. So the South African group was helping coordinating the data training and also capacity building, data management. So apart from those 3 countries in red, 3 more will be added. We don't know which ones, but the consortium will expand. And each one of those countries will have their own grant. So in Tanzania, we have 2 grants, one for SPARCO Tanzania, where I'm PI, and then there will be another grant for SPARCO Tanzania, where my mentor, Professor Makani, will be PI, and this will be for clinical coordination for the entire Sub-Saharan Africa. And then South Africa, hopefully they'll also be funded to continue data coordination. So besides that grant, I'm a co-investigator in several other awards. This here is an R25 award to professors here at MUHAS, and we got this award in 2018. It runs until 2023. It's part of the HAPPY program, and it's called Transforming Health Professions Education in Tanzania, or TET. So here we are training educators in health sciences to develop curricula, to be able to deliver the curricula. And for the young faculty, we have a community, we call it Community of Young Research Peers, where we mentor them in research. So I am the lead for that community of young research peers. We recently published this article in BMC Medical Education to describe how we approach mentoring in this. So we have what we call dual. We have vertical up, down, but we also have horizontal sort of mentoring. And we are coming all the way down from undergraduate level all the way up to professors in the team. And I was glad when I was looking at the profile of fellows this year to see 2 medical students, Emily and I think Tatiana, who are part of this. Just reminded me of this. Okay, so I'm also a co-investigator in a D43 grant offered to Dartmouth, where I did my PhD. We continue to collaborate, and this is a grant that we wrote as a continuation. As you can see, the duration there, it started way back. They keep on renewing it in different names, and I was trained partly back then when it was still ITRI. Now I think it's a D43 mechanism. We are partnered with Boston University, and the current phase focuses in strengthening or establishing the Infectious Disease Institute at our university. We also have a D43 with Northwestern University, focusing on patient-centered outcomes research. And this runs between 2019 and 2024. And as part of, because I said earlier, I'm teaching, yes, and doing research, but also have the administrative responsibility of overseeing postgraduate education here, master, PhD, postdoc. And as part of that, we collaborated with colleagues from Norway, the University of Oslo, and we wrote a grant which was submitted to NORHED, which is, I think, like a mirror image of NIH in Norway. And it was just funded recently for also 5 years. And the aim of this will be to strengthen doctoral education at our university, but we are collaborating with the University of Dodoma, another university in Tanzania, in developing short courses, upgrading the systems, making sure maybe we have an online application system and things like that. So that is what I wanted to say in terms of my career and funding trajectory. And then maybe a few things that I've learned to date, which I would like to share with you. Number one, the small grants and fellowships are very impactful. I will tell you for sure, when I was writing the U01 grant, I proposed continuation of things that I did when I was a fellow, like you, the work that I did back then. So, and the way to look at it is that small fellowship, although the funding level is small, but it gives you the ability to practice being a PI. And the difference with bigger grants is just the scale. But in terms of content, it's the same. You have to have a data person in finance. You have to know how to manage your team, ethical approval, dealing with media, university, and everything. So the skill that you get are invaluable. And so although the funding level may be small, but just look at it that way, that it gives you the experiences that you will need going in the future. What I've also learned is it's very important to involve yourself with established research groups other than try to branch off early on for many reasons. One is that with established groups, they have network, they are trusted by funders. So if you work in a network, you'll be introduced to funders, they will know you, they will learn to trust you, you establish a professional rapport. So when an opportunity comes to apply for a grant, you'll be head and shoulders above others because you have all these other professional connections that you've created. Because I'm sure for NIH, they are receiving thousands of great grants. So why you should stand above the rest, I think part of it is how well you are known in the network. So you have opportunity to go into conferences, meet colleagues, and that one is goes far in terms of what you can get in the future in your careers. The other thing is to create a body of work. I know there may be diverse interests in the beginning, you have many things that you're doing, but whatever it is, make sure whatever you're doing, you create a good track of publications, for instance, because this is the nature of science in this century. If you are proposing a new thing, it's much easier to be funded if you are backing it up with the preliminary data that is your own work, other than body of knowledge in the literature. Although you can do that, but I think if you can say, we have done this in our group and we are proposing this going forward, then that is much more appealing than we found this in the literature and then we want to do this. Applications, have a track record of applying. I know everybody is excellent. You are used to, succeeding first time, but really in grantsmanship, you will have to make a lot of applications to be funded. So for instance, for me, this was not the UO1 that was funded. It was not my first NIH grant. I had written before and it was not successful, but the experience gave me a lot of knowledge on how to navigate, how much time was required to prepare and things like that. So whatever field of work you are in, make sure you apply and don't give up when you do not succeed. The other thing is maybe a point of debate, but how much time and how hard to work towards success in developing your careers. So I know there's a need to do what they call work-life balance so that you don't exhaust yourself in work. But for me, I want to, maybe invite you to think not necessarily in work balance every day, but maybe in stretches of years. So you can think maybe in your career life that spans so many years. Maybe you have a few years where you work really, really hard. And then other years, maybe you relax a little bit. And for now, you are young, you are the prime of your academic careers. Maybe you need to work a little bit harder to be able to succeed. As you know, yes, it's competitive out there, but also to get things at the tip of your fingers you really need to have sustained a time when you work really hard on the same subject. Be writing grants, writing papers, and that will amount. But obviously, don't forget family. Here is a photo of the little ones for us, for me and my wife. And yeah, beautiful things. But otherwise, those are the few things that I wanted to share with you. And just by way of starting the discussion, and I hope you find this useful and you can use some of this going forward. Thank you very much.
Well, thank you, Dr. Emmanuel Balandya. I thought this was really great. And first off, I want to congratulate you on all the milestones and accomplishments that you shared with us. And I think it's really inspiring. And yeah, so I think it's great that we have time for engaging in informal discussion. So before we open it up to our fellows, I wanted to kind of get your comments and reflections on some of these key lessons that you highlighted. So one thing that you mentioned was the value of small grants, right? So your thoughts about, so I think there's a balance in terms of creating opportunities so that you become a content expert in a specific area. And I think those are an opportune time for leveraging small grants to start learning about certain concepts. At the same time, you mentioned, like a lot of grants, it's better to have some preliminary data to support your larger grants. So your thoughts about leveraging small grants to fulfill both of those. So whether it's learning new concepts, new content area, or establishing a track where you're leveraging small grants to collect preliminary data to support a larger proposal.
Thanks very much, Lee. Very challenging question. Because I think what I've also learned here is that, especially in my local context in Tanzania, you can do a lot with small amount of money. And it can be within the scope, but you can even expand it beyond. So I remember the same level of funding that you are getting here. Apart from my work, I was able to buy some equipment for the physiology lab where I work. And I was able to support one of the students who was doing a completely different thing, from the same money. So you may say this is a small amount of money, but because you're working in a university environment that takes in a lot of responsibilities for faculty, you can stretch that money really, really far. So in so doing, in terms of creating a body of knowledge, if you're really dedicated, you can do a lot directly to report for the fellowship, but you can create a system that can continue even after that for the same amount of money. As I speak, for instance, I have PBMC, peripheral blood molecular cells, sitting there in the liquid nitrogen. That one day, if I wake up at 3 a.m. with a crazy idea, I may go back and do something with those cells. And the money and resources that enable those cells to be there were from this very grant. So we can see it keeps on giving. So I think I will insist in being consistent and make sure whatever endeavor that you decide to take through, which will take you a year or more, make sure it creates a reasonable body of knowledge that you can go back to it and apply a grant. And whether that's going to be another small grant to stretch it or a bigger grant. Because once you don't have a publication from your work, or you have one, so then it becomes very difficult for you to tie up things and apply for a bigger one. So you have to be strategic, but don't be discouraged by a small amount of money. It can go far. And always have that in mind. Make sure whatever you're doing, you have some publications, a good number of publications, and a good track history to help you jump to the next step. I hope I've tried, Lee.
Yeah, I think you answered my question, and so I want to open it up to our fellows, and please go ahead and feel free to engage in a conversation with Dr. Balandya. So you can unmute yourself, or yeah, however you want to do.
Thank you so much for that inspirational talk. I'm just going to pick your brain again on this last point you brought up about publication. And what if you, for example, from this 1 year, yes, we're meant to have a publication, and in this 1 year, your idea is not really led to a publication, and you probably just have abstracts. How do you then tie that to the next grant application and make yourself competitive when you're still just referencing the literature and not necessarily yourself?
Yeah, it's hard. If you're just referencing literature, then I'll be frank with you, it's very difficult to get funded. But if your work is still in progress, it's okay. All I would say is, before the fellowship expires, make sure you commit all the resources in something, so that yes, the money will have expired. You cannot access the money anymore, but you have systems, you have data in place that you can go back, use it, and continue your work. And then, for instance, one of the things that I did, I published a review article that didn't require existing data, but it was a nice review article in a nice journal. Okay, so basically the literature review that you're doing for your publication of primary research, you can write it nicely into a review article. So there are many ways of having a publication. If you're doing some novel work, you can also, this day they have methods papers. You can publish the methods themselves before the actual data. So as you're waiting, and I think this was a trajectory for me also, the first paper to get out was actually the review article, and then later on the primary work came after the fellowship. So you can do all of these things. You can do review articles, you can do methods papers, and then you can have the primary data that all of these add together. Okay.
Great, helpful, really helpful suggestions. Okay, so feel free to engage. Esteria or Dirk?
Thank you, Dr.
Oh, no, Esteria, go ahead.
Okay.
Thank you, Lee. Yeah. Thank you, Lee.
Go ahead. Esteria, go ahead. And then
Can I go ahead?
Yeah, go ahead, and then we have Dirk after.
Okay. Thank you, Lee. Thank you, Lee. And thank you, Dr. Emmanuel, for your inspirational talk for today. So I was just wondering if you can share with us your experience with NIH grant writing. What was your challenge that you faced during your career, especially on the application process and the whole navigations on how to get this, like to capture these grants? Because I think for most of us junior colleagues, I think sometimes NIH somehow look the grants look somehow difficult during the process of applications. So I was just wondering, how did you, what's your experience, and what do you want to share with us, your experience with regard to grant writing? Thank you.
Thanks very much. Yeah, I've learned a lot. I think the first one that I wrote was maybe 3 years back with colleagues in Dartmouth. For some reason, we started writing a little bit late. We put in a lot of effort, but it wasn't successful. So the first thing that I learned was, prepare yourself ahead of time. You need to have a lot of time. And since then, so the Transforming Health Education grant and the U01 grant, both of those grants, I remember I actually took a holiday during the writing period. And that's how I used my holiday for each one of those grants. But even, the holiday itself was not enough. I remember the U01 grant, we applied it almost a year now when we were applying. And I remember, you know, there were sleepless nights for sure. I'll wait for people at home to go to sleep, and that's when I'll wake up and start writing until in the morning. I think someone will wake up and I will be wondering whether they're going to the washroom, but they stay along. And as I look at the watch, it's already 6 a.m. So I knew, okay, though it's my time to go and maybe have a sleep. So that's how the way it was. It's a lot of writing. And I understand for you know, for most of us who are coming from, let's say, Sub-Saharan Africa, our universities are not well capacitated to have a very big pre-award, post-award team and things like that. And so you have to do a lot to write. So you need a lot of time. And there may be that feeling of disappointment when you have done all this work and then you're not funded. But as I said earlier, just keep on trying. Each experience builds up for you. So for instance, for me, if someone talks about a grant, I need to ask, when is this going to be submitted? I need time. And then you learn also to evaluate the RFA and see where you fit. You have to develop that skill also, to look at it and say, who is competing for this and what are the chances? And usually when you see that you have some chances, you have more energy to go in it and apply. So, you know, I've done both in terms of jumping into the ocean, but then also I've been given a cup. So the cup was the whole U01. It was structured in a way that we knew we were highly competitive, you know, because we are looking to expand, but sites that already had a sickle cell cohort had a lot of advantage, and we were, you know, one of the 3 who already had that. So it was really a unique situation where everything lined up literally for us to you know, be successful. But as they say, you know, success comes to those who are prepared. So yes, you can see success now and maybe things lined up, but it's a result of 4 years or more of a lot of work to put things in place. And when I talk about creating a track record, not only publication, but even a cohort, you know, there's a lot of work if you've done, and you can showcase this and use them to build toward the next thing. The connections, everything. But for sure, you need time to write, you need patience. And for a guy like me, where English is not the first language, you need someone who speaks English as the first language. So for us, we had a great colleague from UK and another professor, you know, Professor Richo, who helped us a lot in putting together the science and the English and everything. So basically, you need to have a PI who is driven. So you need to be driven to have the focus, but you need other people together with you. You need someone who organizes everything, because grants these days are collaborative. So you need to mobilize a lot of other people to get their letter of support and know who will do what during the application, but also when the grant is funded. So you need someone who is very good in organizing, and it doesn't have to be you doing everything. So you can have the big picture, and then someone who helps you with the organizing, and someone who is experienced with the system and kind of tells you this one is not as good, and you know. So I remember, yeah, my colleague from the UK was the one that would send document, and she would look in and say, you know, I think this one needs to be better in this way or that way. So it's a system that goes together as such. So yeah.
Okay.
I hope that one helps.
So I think it's yeah, okay. So like I think you need to have a very strong mentorship, like
Exactly.
after like having everything, you must have a very strong mentorship team. I think that's what I get from the last point.
Yes, and
Okay,
you need
thank
to
you
be ready
very
because
much.
for you, all of you, I think you're growing to become PI yourselves. So you really need to have the motivation to drive the team. As I'm saying, there are sleepless nights. So it will be up to you to decide that I'm staying awake. Nobody will tell you to wake up.
Exactly.
All right.
All right. Well, thank
Thank
you.
you.
Okay, so Dirk, you had some comments or questions?
Sure. Yes. Thank you so much for that great talk, Dr. Balandya. I was wondering if you could speak a little bit more to the relationships, the collaborations that you mentioned that you started many years ago as a fellow, and how you've maintained those or strengthened those over the year, making sure they're still beneficial for you and for the folks that you're working with.
Thanks very much. I'll speak as an example, the Dartmouth connection. We've worked with Dartmouth Group for a long time here in Tanzania. So it started as a collaborative, and we are doing clinical studies. We were funded to do a TB vaccine trial. It was one of the first phase 3 trial that went all the way to the end. And as part of that platform, we decided, my predecessor decided to write a training grant, and then it was funded in 2013 for the first time. And there were colleagues, I think 2 PhD went before me, and then I was the third one to go in 2008. And I think those 4 years were really important for me in the US because I got to live and interact with my colleagues in the US more intimately. I knew their families, I know their children, I know everything. So I think that kind of professional social connection established a very strong bond. And even after that, we continue to collaborate on various other initiatives, including writing grants. They exchange students who come in, we help them. Um, uh, Through that platform, many other PIs from the US applied and were able to get funding and continue in the training. So I think it's very important if you can establish solid relationship with collaborators. You can get connection anywhere. It may be like for me, maybe a long-term training, but for others, it will be maybe a research collaboration. Uh, if it's starting these days, I don't know, with COVID and online things, I don't know. That's why I think it's very necessary also to meet physically whenever possible. But at least for those connections for me, I already have that. But they're instrumental. I remember, yesterday I just sent one of my colleagues a manuscript. We were finalizing a manuscript and I just sent it to him. Can you have a look at this for English? And he says, okay, I'll set aside some days in this week to do it. But you wouldn't do that if someone that you don't have very solid, intimate connection. So the one that I sent to is my PhD mentor, who feels like I'm his baby and he has to do everything to make sure I succeed. So yeah, having those connections, I think is important. And whenever opportunity arises, grab the opportunity, and sometimes it's up to you to continue those relationships. Make sure you write that email and send that holiday wish. Yeah.
Great. Thank you very much.
Thank you.
Yeah, all great comments and suggestions. And, I just have to say that, again, congrats on all your accomplishments. And just listening to you, I want to collaborate with you. And I think that's really important in terms of how you present yourself in a professional setting, but also kind of being open to, learning new things. And I think, in terms of the grants and Asteria, the question you had was, I think it's really important that, writing a grant involves many things. So as Dr. Emmanuel Balandya mentioned, you need to kind of link yourself to a very established institution because the pre-award and post-award team. So a grant proposal obviously has a research plan, but there's so many things that goes into preparing the grant, like whether it's budget, resources, bio sketches, and NIH changes the format all the time. We actually just had to reformat all of our bio sketches, for the grants going in the month of May. So it is really important to establish your connection with an institution that's very knowledgeable about these things. And I think the other comment that really resonated with me was, in terms of work-life balance, I think, as Dr. Balandya said, sometimes you really have to, be intentional about, like working really hard. But I would say that's more about, I think of it as making an investment right now so that it pays off in the end. So you're investing a lot of time. It might be really, really hard, but once you become successful, I think that's gonna create more opportunities for you to enjoy more meaningful work-life balance. And the other thing about grants, I think it's okay to fail. My mentor told me that if you write 10 grants and you get one funded, that's a success. So I think it's okay to face adversity, but at the same time align yourself with great mentors, great institution, and also these establishing meaningful relationship with others. And I think the whole concept of pursuing team science is really important. So if you establish yourself as one critical team member that is very, very useful, then you can have all the other team members who have expertise in other areas. And then as a whole, you have a really great team. So I think all these points that Dr. Balandya mentioned, I think it's really, very useful and impactful. So we still have some time. Any additional questions for Dr. Balandya? Richard, we have like at least 5 more minutes, 10 more minutes. Okay. Yeah, this is your opportunity.
Hi, thank you very much for your talk. I was wondering, how did you took the decision to go, your area of expertise and what you were developing when you moved to Tanzania was immunology and sickle cell, and then you became a PI of training grants. I was wondering, how did you took that decision, and if how much time of your of what you are giving for the academic part are you spending on those grants, and do you feel that that is something that will keep going, or is going to pass to others and then you focus more on research?
Great questions. Yeah, you're asking as if you're in Tanzania. I am, yeah, when I came back, that was 2014. MUHAS was transitioning into another administration, because here we have what we call trienniums. So every administration sets for 3 years, and then they have to, either be reappointed or step down, and others will jump in. So yeah, this is something that every young researcher wishes not to be in it, to be appointed into administration, because it can really take your time away from research. But sometimes it's inevitable because there's a lot of demand. So for instance, we are training here, and our university is the largest training institution for healthcare workers. So there's that weight on your shoulders, like, okay, we need to do what you're doing also, we need to get it right. And if there's no one, because you're approached and you are asked to do this, and I kept on discussing this with my mentor. Even, I've served in this position as a deputy and now current head for postgraduate for 6 years now. Even now, they still, you know, when we're having this informal discussion, they tell me the same, like, it's not a matter of doing one versus the other. It's a matter of balancing the two. Because there's no way you can, you know, once you have the know-how and the experience, there's no way the university can just, you know, just say, okay, I'm done, and that's it. So your expertise may still be needed. We have maybe this year, there may be another transition. I don't know whether I would like to continue in it or not, but I've looked at the 6 years that I've served, and I think there are a lot of things that I'm proud of, that I was able to contribute outside of my own research, in terms of putting in systems for others to come in and train and be great physicians and all this out there. So I've really, for the moment that I am serving in this, I've resigned to the fact that I have to balance. I have to balance to succeed in everything, in the administration part, academia, in research, and also at home, you know. Yeah, I mean, I remember those few days, because you know, for me, for instance, I got married that year in 2014, and then I got babies really late. My first one is 2.5, so you can imagine. So the first few years, it was just me and my wife, and really I was basically working. I would come out of the office at 11 p.m. and go home to sleep, and then at 5 I'm awake. So unfortunately, it was like that. And I understand the work-life balance that's needed, but at least that burst of work, it wasn't for nothing for me, in the sense that we put together systems, and I was able to find time in that busy schedule to do the sciences. And the good thing about MUHAS is all these grants are awarded to MUHAS, and you are the focal person, like the PI. So the next thing that I'm really passionate about is training. So that's what you're doing in TED, to train other people, make sure others are growing to the caliber, so that they can take over once we transition into other things. So I would say, if you can avoid administration, I'm okay, you can, but the other thing that I'll tell you, which is experience for me, is I think I became more productive when I took on an administrative role, because I understood the value of time, the little time that I had to set aside to do my own things. So for instance, now in the office, they know Thursday is Emmanuel Research Day, so don't touch Emmanuel on Thursdays. When it's Thursday, I know I have to do a lot more, and I have to have a deliverable, because I'm not going to have another Thursday until 7 days later. When you have all that open check for time, for science, maybe the productivity may not be as much. So I would say, you know, I mean, if you look at my trajectory, I would say you can, if you can avoid science, so that you have more, if you can avoid administration to have more protected time for science, try. But the caveat is that you may not have the motivation. So I don't know how you balance those two. I'm not sure if it's a complex.
Yes, thank you. It's very complex, because I guess it's very similar, but in some of the LMIC countries, once you come back, you are there and you're requested to, hey, we need you here, and there are like a lot of things. So I was wondering, how did you manage to actually protect your time for being so productive with research, when very likely you were in the very, very same position, and you have done amazingly. So thank you.
Yeah.
It gives me hope.
You can do it. I make sure I train others. Like I've downgraded substantially my teaching load. I decided not to forsake everything for the sake of being active. So, but I make sure there's someone junior who knows everything that I was doing and they're able to do it. We increase the enrollment of master students in my program. And after the first year, when they're in the second year, we give them some teaching responsibility for the undergraduate first year. So all these innovative things that you can do to offload what you're doing, but in the same time, create capacity for others long term.
Thank you.
Well, so I've had such a wonderful time learning from you today, and I hope it's okay for our fellows to keep in touch with you and reach out to you if they want any more additional advice. So it's been wonderful having you, and thank you for sharing your time today. I really appreciate it.
Thanks very much, and I wish you all the fellows all the best. And Lee,
All right.
best.
Great. Thank you so much. All right.
Okay.
Have a great day, everyone.
Thank you.
Thank you, Lee. Thank you, Emmanuel.
Thank you.